The REBT Advocates, Episode 12, with Dr. Michael R. Adelstein and me, Tommy Bateman. Let's get started. Michael, today we wanted to talk about how REBT can be used with couples therapy. I think, the REBT is a multimodal or multi-use therapy, and bringing it into the couples room is no different. So today what I wanted to do was start with what does it look like when a couple comes in to you, the intake session or the very first session? What happens in between? What does the work look like? And what is the typical discharge? Meaning, when are they done with you? When is the couple done with you? And how does REBT fit into all of this? So let's start. The couple walks in. What does it look like?
Well, what I normally do is I ask them each what their goal is for the therapy, and often some of them have different goals. One says, well, cure my husband. The other one says, cure my wife. So first we come up with a goal they mutually agree on, like have fewer arguments. Mm-hmm. And if they both agree they want to have fewer arguments, then I ask them for some examples so I get a better context. Then I'll teach them the problem separation technique, which we've discussed before. And that says that we have practical problems in our life, such as how to get up on time in the morning, or how to do a better job at work, or how to have my child listen to me more. Those are all practical problems. And then we often create emotional problems about that, mm-hmm. depressed about this prospect of facing work, or angry at my wife, or over frustrated with my child. So those are emotional problems. I explain that to the couples and ask them which they would like to start with, the practical problem or the emotional problem. And then we go from there. And from there, it's largely REBT, the way I would work with an individual, where normally they would ask me, well, what do you think is best to start with? And I say, well, usually it's best to start with the emotional problem, because if you're angry or anxious or hurt, it's going to be harder to implement practical solutions. Mm-hmm. And they agree. So then I help them. I explain REBT, as we've discussed before, some of the basic principles. Then I help them each identify some of their demands, some of their musts and shoulds. Then in the session, I give them each a 3-minute exercise form, which you can see the URL to that on your, would it be under the screen or on the screen? Under the screen, and teach them with that form in front of them. I teach them how to do the 3-minute exercises. Then in terms of practical solutions, there are a few things that tend to be very helpful with couples. One is giving each other a lot of positive feedback. The more positive feedback, the better. 3 times a day, 4 times a day, 5 times a day. And also to have regularly scheduled relationship discussions, which means on a regular basis. Most couples do it once a week for 15 or 20 minutes. They discuss the relationship. First start with positives, things that have been positive in the last week, and then some problem that they'd like to discuss and try to reach some solution on. So that's the bare outline of it. Does that seem to make sense, Tommy?
Yes, and what I think is really interesting that folks may not have picked out of that is, unlike some other therapies out there, you name it, REBT doesn't treat the relationship, because the relationship isn't a real thing. What you're treating is each individual in the relationship, kind of one at a time. The musts and demands aren't held by the relationship. The musts and demands are held by each partner in that relationship. So that's why we're working on each individual, not some sort of system, not some sort of relationship that's it's an abstract thing, not the people themselves.
That's very good. I think it's good you mentioned some things we don't do. Another thing we don't do is talk about each individual's childhood or dysfunctional families and things like that, because that's irrelevant, a waste of their time and money. What's relevant is what they're doing and thinking right now in the relationship. One of the things that we do that other therapists don't do, particularly, I heard David Burns mention this a few times, mm-hmm. one in a video and one in a workshop. he was conducting I was at, and he said, you can't, when couples are angry, you can't help them. So he never works with couples who have anger problems. And that's totally incorrect. I help angry couples frequently, just as I help angry clients, because there's no structural difference between angry or hurt or anxious people. They still are thinking irrationally. They have demands, musts and shoulds, and you show them how to get over their demands and focus on their preferences and practical solutions, and then anger is not an issue. Now, apparently, he doesn't know how to deal with anger, because if he did, he would do the same thing he does in his individual therapy with anger. He would do that with couples. So you definitely can help all emotional problems that you help someone with in an individual session by teaching them REBT and insisting that they do write out the 3-minute exercises regularly, question, challenge, and contradict their demands.
And so we do the 3-minute exercises. We do the problem separation technique that we talked about. What happens? What does a couple look like that are ready to be discharged?
Well, I normally don't discharge people. They discharge themselves, because they have a better idea of whether they got out of the therapy what they want or whether they want more. But normally what it looks like is when they decide they've got out of the therapy what they wanted, they're doing much better. They're getting along much better. They're no longer talking about divorce or being at each other's throats or being withdrawn or hurt. They know how to bring up problems in a constructive way and are doing that. And they know how to do the 3-minute exercises and address future emotional problems that come up, because the structure is the same. The content may be different, but the structure is the same, so they use the same structure.
So it sounds like REBT, when they come in, they have irrational thoughts about each other when the couples come in. REBT teaches them to get rid of those irrational thinking, move towards practical solutions, and not having these mustiness, these demands of one another. And when they leave, they are more emotionally resilient beings because they're not thinking as irrationally as they did before. Does that sound about right?
That is about right. And thanks very much for the interview. I think it was very worthwhile.
Absolutely. Thank you, Michael.